Orthopedic Surgeon Dr. Sipe often sees patients dealing with thumb arthritis.
They have severe pain. Often they have a deformity where the thumb bone starts to slide out and they can't grasp things. They don't want to open things. They basically stop doing certain motions that are very painful.
While fusing the bone is an option, he says replacing the bone is often best. That can be done as an outpatient surgery.
I'm using what's called a suspension arthroplasty, which ties the base of the two bones together, and it keeps that space open. And I just found it to be the least painful and the quickest recovery.
The entire process is done through tiny incisions.
Same day surgery. They come in, they get a block, they go to sleep for an hour, they get the procedure, they wake up in a splint. They go home. They really do nothing for the first 2 weeks as far as therapy or anything. Then I see them back in the office at 12 days. We remove the splint. We give them a removable splint so they can shower, take a look at their incisions, and then they do therapy.
Pain is usually gone after about 6 weeks.
I tell people for all joint replacements, 80% of the healing happens in the first 3 months. Little things can take all year, but most people are happy by 4 to 6 weeks.
Restoring function and reducing pain through a simple surgery. You can learn more by searching for orthopedics on lehealth.org. For Lee Health, I'm Devin Turk.